If I couldn't put in a continuous catheter and send patients home with pumps to give them continuous peripheral local anesthetic infusions, it would be devastating to me, because I feel we give our patients the best care when we can do that. And so many things are better for the patient when they have minimal pain. If they're not having to take narcotics, they're avoiding a lot of side effects. We all know the multitude of narcotic side effects. But also we have less of a stress response. The body is not being stressed as much to recover from surgery if we don't have pain. It would be terrible to me to not to be able to continue to do continuous catheters.
My first thoughts when I saw the Nimbus pump was that it was incredibly logical. I ran a nerve block program prior to coming to work at this company, worked with some other devices. And when I saw this, it just made sense from a clinical standpoint, easy to use, and just the variability, the way that you can just, per patient, because you treat each patient itself, and you'll be able to customize it per patient as needed.
The thing about the Nimbus pump, it gives you so many options of how you want to set up your programs, that you can try different things. And you may find in certain blocks you want to do an intermittent bolus, other ones you might want to do a continuous infusion, other catheter placements you want to do both.
As far as the way continuous nerve catheters will impact healthcare, it's clearly shown that our surgical direction is more on the outpatient side. More and more patients are being done on a same-day basis, and what tends to keep them in the hospital is poor pain management. With nerve catheters, this is just helping us do bigger and more painful cases on an outpatient basis. I only see this moving forward in terms of offering more patients the opportunity to go home the same day and have much better pain control.
I've known about the Nimbus pump from very early days, and I was fortunate to know the people working with the pump, and they asked me my opinions and some of the things that would be beneficial. And we had some great ideas, and it offers so many advantages. I love the fact that the patient can give themselves a bolus. There are certain catheter placements that I think a bolus is very beneficial with. Infraclavicular catheters to get that spread. Adductor canal catheters to get spread with a bolus that you don't get with just a slow infusion. I like for patients to have control, and I want the patients to have the ability to hit their own bolus button, and they know when they're hurting. They need to be in control of when they're getting the extra doses. There were studies 20, 25 years ago when IV-PCA first came out, and patients felt like they did better just because they had that button and they had control of when they were getting their pain medicine.
We initially heard about the Nimbus PainPRO because we were looking for better options for our patients in terms of home infusions. We had tried virtually every pump system that was out there.
Once they see it, feel it, they're happy with it, and they come around and they're like, okay, I get it. And they usually will say, this is going to be so much better for the patient. The patient's really going to get the medication they need.
The elastomeric pumps I'm not really impressed with the ones that do have a bolus function. Haven't been really impressed. They just kind of look kind of cheap, kind of plasticky. And to be the Nimbus pump is electronic, it's high tech. I think patients in this day and age, it's a high tech world.
Our volumes had increased so much that this became an economic burden for our facility. But we still wanted to be able to provide a continuous nerve catheter program for all our patients. The PainPRO pump actually was a better solution to what we had as our current electronic pump system.
We can increase access for patients all over the world that need to have a pump. It should be having the benefit of a catheter and a pump to manage their postoperative pain, reduce their reliance on narcotics, keep it out of the medicine cabinet, keep it off the streets.